Today, we will discuss the pharmacologic classes, therapeutic uses, mode of action, side effects, and nursing considerations for drugs commonly used in the treatment of asthma, airway inflammation, and bronchoconstriction. Understanding these medications, their mechanisms of action, and potential side effects can optimize patient care and ensure effective management of respiratory conditions. Adrenergics therapeutic class. Bronchodilators are medications used to treat respiratory conditions like asthma and COPD by relaxing the airway muscles, improving airflow, and relieving symptoms. Albuterol sulfate, Proventil, ProAir, common form. Inhaler or nebulizer uses, indications. To prevent or treat bronchospasm in patients with obstructive airway disease. Mode of action. Albuterol sulfate works by relaxing bronchial and vascular smooth muscle through the stimulation of beta-2 receptors. Side effects: tachycardia, palpitations, headache, anxiety, dizziness, and bronchospasm. Nursing considerations. Monitor for bronchospasm after the first dose, discontinue the medication and notify the healthcare provider if bronchospasm occurs. Monitor potassium levels when given with loop diuretics, as it may cause hypokalemia. Albuterol may also prolong the QT interval when given with certain antiarrhythmics like amiodarone. Levalbuterol, Zopnex, common form, inhaler or nebulizer. Uses, indications, same as albuterol. Mode of action. Levalbuterol has a similar mode of action to albuterol but may cause less tachycardia. It is sometimes preferred in cardiac patients. Side effects: less tachycardia compared to albuterol. Nursing considerations. Similar to albuterol, monitor for bronchospasm, and consider the patient's cardiovascular status. Epinephrine, adrenaline, racemic EPI, common form, inhaler, nebulizer, SQ pen, EPI pen, IV during a code. Uses, indications, anaphylaxis, asthma, and cardiac resuscitation. Mode of action. Epinephrine activates alpha and beta receptors, which relaxes bronchial smooth muscles and stimulates alpha and beta receptors in the sympathetic nervous system, SNS. Side effects: serious cardiac arrhythmias such as ventricular fibrillation, palpitations, hypertension, chest pain, and central nervous system effects like cerebral hemorrhage. Nursing considerations. Patients receiving epinephrine should be closely monitored. Epinephrine is typically used in emergent situations. LABA, long-acting beta agonist. Salmeterol, Ceravent, common form, inhaler, powder. Uses, indications. Long-term maintenance of asthma and as concomitant therapy with an inhaled corticosteroid in patients with nocturnal asthma or reversible obstructive airway disease in COPD. Mode of action. Salmeterol selectively activates beta-2 receptors, resulting in bronchodilation. It also blocks the release of allergic mediators from mast cells. Side effects: similar to albuterol, tachycardia, palpitations, hypertension, but no hypokalemia. Anxiety, headaches, and dizziness may also occur. Nursing considerations. Salmeterol is not a rescue inhaler and should be used for maintenance purposes only. Corticosteroids. Beclomethasone, Cavar Redihaler, common form, inhaler. Uses, indications, chronic asthma. Mode of action. Beclomethasone may decrease inflammation by reducing the number and activity of inflammatory cells, inhibiting bronchoconstrictor mechanisms, producing direct smooth muscle relaxation, and decreasing airway hyperresponsiveness. Side effects: life-threatening conditions such as adrenal insufficiency, angioedema, and fungal infections. Other side effects include oral and pharyngeal candidiasis, bronchospasm, and sore throat. Nursing considerations. Tapering may be necessary when discontinuing this medication. Rinsing the mouth after each use can help prevent oral candidiasis. Beclomethasone is not a rescue inhaler and should be used for maintenance purposes only. Methylprednisone, Solumedrol, common form, oral or IV, systemic effects. Uses, indications, acute exacerbations of asthma. Mode of action. Methylprednisone's mechanism of action is not clearly defined. It is believed to decrease inflammation by stabilizing leukocyte lysosomal membranes, suppressing the immune response, stimulating bone marrow, and influencing protein, fat, and carbohydrate metabolism. Side effects: increased susceptibility to infections, headaches, seizures, and pulmonary edema. Nursing considerations: methylprednisone should be used for acute exacerbations and systemic effects should be considered. Careful monitoring of the patient's condition and potential side effects is necessary. Fluticasone salmeterol, Advair, common form, inhaler. Uses, indications. Treatment of asthma patients not adequately controlled on an inhaled steroid or other LABA, maintenance treatment of COPD. Mode of action. Fluticasone is a corticosteroid that reduces inflammation, while salmeterol is a long-acting beta agonist that promotes bronchodilation. Side effects: increased risk of pneumonia, oral candidiasis, hoarseness, bronchospasm, and adrenal insufficiency in rare cases. Nursing considerations: regular monitoring of lung function, including peak flow measurements, is essential. Rinse mouth after use to prevent oral candidiasis. Advise patients to carry a rescue inhaler for acute symptoms. Anticholinergics. Ipratropium bromide, Atrovent, common form, inhaler or nebulizer. Uses, indications. Maintenance treatment of bronchospasm associated with chronic obstructive pulmonary disease, COPD, including chronic bronchitis and emphysema. Mode of action. Ipratropium bromide blocks the action of acetylcholine at parasympathetic sites in bronchial smooth muscle, resulting in bronchodilation. Side effects: dry mouth, blurred vision, urinary retention, constipation, and worsening of narrow-angle glaucoma. Nursing considerations: monitor for anticholinergic side effects and assess urinary output. Encourage adequate fluid intake to prevent dry mouth. Ipratropium bromide is not a rescue inhaler and should be used for maintenance purposes only. LAMA, long-acting muscarinic antagonist. Tiotropium bromide, Spiriva, common form, inhaler, handihaler. Uses, indications. Long-term maintenance treatment of bronchospasm associated with COPD, including chronic bronchitis and emphysema. Mode of action. Tiotropium bromide is a long-acting anticholinergic that blocks the action of acetylcholine at parasympathetic sites in bronchial smooth muscle, leading to bronchodilation. Side effects: dry mouth, blurred vision, urinary retention, constipation, and worsening of narrow-angle glaucoma. Nursing considerations. Similar to ipratropium bromide, monitor for anticholinergic side effects and assess urinary output. Encourage adequate fluid intake to prevent dry mouth. Tiotropium bromide is not a rescue inhaler and should be used for maintenance purposes only. Leukotriene modifiers. Montelukast, singular, common form, tablet, chewable tablet, granules. Uses, indications. Prophylaxis and chronic treatment of asthma, relief of symptoms of seasonal allergic rhinitis, and prevention of exercise-induced bronchoconstriction. Mode of action. Montelukast is a selective leukotriene receptor antagonist that inhibits the action of leukotrienes, which are potent inflammatory mediators involved in the pathogenesis of asthma and allergic rhinitis. Side effects: headache, gastrointestinal disturbances, mood changes, and increased risk of neuropsychiatric events. Nursing considerations. Monitor for mood changes and neuropsychiatric events, especially in pediatric patients. Advise patients to take Montelukast regularly as prescribed. Zafirlukast, accolate, common form, tablet. Uses, indications. Prophylaxis and chronic treatment of asthma, not for acute asthma attacks. Mode of action. Zafirlukast is a selective leukotriene receptor antagonist that inhibits the action of leukotrienes, reducing airway inflammation and bronchoconstriction. Side effects: headache, gastrointestinal disturbances, hepatic dysfunction. Nursing considerations. Monitor liver function tests regularly. Zafirlukast is not a rescue medication and should be used for maintenance purposes only. Treatments for congestion, cough, and allergy. Antihistamines. Azolastine, Astelin, common form, nasal spray. Uses, indications. Allergic rhinitis. Mode of action. Azolastine is a histamine, H1, receptor antagonist that blocks the effects of histamine, reducing nasal congestion and other allergic symptoms. Side effects. Epistaxis, nosebleed, headache, unpleasant taste. Nursing considerations. Azolastine is a nasal spray and should be used as directed. Monitor for nosebleeds and advise patients about the potential unpleasant taste. Olopatadine, Patanase, common form, nasal spray. Uses, indications. Allergic rhinitis. Mode of action. Olopatadine is a histamine, H1, receptor antagonist that blocks the effects of histamine, reducing nasal congestion and other allergic symptoms. Side effects. Headache, nasal spray, non-sedating. Nursing considerations. Olopatadine is a nasal spray and should be used as directed. Educate patients about proper nasal spray technique. It is considered non-sedating. Loratadine, Claritin, common form, oral tablet. Uses, indications. Allergic rhinitis. Mode of action. Loratadine is an oral, non-sedating antihistamine that blocks the effects of histamine, reducing symptoms of allergic rhinitis. Side effects. Oral, non-sedating. It is best taken prophylactically, as a preventive measure. Nursing considerations. Advise patients to take loratadine regularly as prescribed, especially before exposure to allergens. Diphenhydramine, Benadryl, common form, oral tablet. Uses, indications. Allergic rhinitis, cough. Mode of action. Diphenhydramine is a sedating antihistamine that blocks the effects of histamine, reducing allergic symptoms and cough. Side effects. Sedation, dry mouth, constipation. Nursing considerations. Diphenhydramine is sedating and should be used with caution, especially when driving or operating machinery. Encourage patients to maintain adequate hydration and oral care due to the potential for dry mouth. Decongestants. Phenylephrine, neosynephrine, common form, nasal spray, short-acting. Uses, indications. Allergic rhinitis, upper respiratory infections, URI. Mode of action. Phenylephrine is an alpha-1 agonist that causes nasal vasoconstriction, reducing nasal congestion. Side effects. CNS stimulation, oral, restlessness, irritability, anxiety, insomnia. Caution with cardiovascular effects, oral. Nursing considerations. Phenylephrine nasal spray should be used for a limited duration, 3-5 days, to prevent rebound congestion. Monitor for CNS stimulation and advise patients about potential cardiovascular effects. Pseudoephedrine, Sudafed, common form, oral tablet. Uses, indications. Allergic rhinitis, upper respiratory infections, URI. Mode of action. Pseudoephedrine is an alpha-1 agonist that causes nasal vasoconstriction, reducing nasal congestion. Side effects. CNS stimulation, oral, potential for abuse, oral. Caution with cardiovascular effects, oral. Nursing considerations. Pseudoephedrine is a medication that can be abused for its stimulant effects. It is important to use it as directed and avoid exceeding the recommended dose. Monitor for CNS stimulation and advise patients about potential cardiovascular effects. Oxymetazoline, Afrin, common form, nasal spray, long-acting. Uses, indications. Allergic rhinitis, upper respiratory infections, URI. Mode of action. Oxymetazoline is an alpha-1 agonist that causes nasal vasoconstriction, reducing nasal congestion. Side effects. Rebound congestion with topical agents, nasal spray, CNS stimulation, oral. Nursing considerations. Oxymetazoline nasal spray should be used for a limited duration, 3-5 days, to prevent rebound congestion. Monitor for CNS stimulation and advise patients about the potential for rebound congestion with prolonged use. Antitussives. Antitussives are medications used to suppress coughing. The 3 types we will discuss are hydrocodone, codeine, and dextromethorphan. DM. Hydrocodone and codeine, common form, oral preparations. Uses, indication. Cough suppression through central nervous system, CNS, suppression. Side effects, respiratory depression, euphoria. Nursing considerations. Opioids have a potential for abuse. Naloxone can be used as an opioid antagonist. Large doses of DM can be abused for CNS effects. Dextromethorphan, DM, common form, oral preparations. Uses, indication. Cough suppression through CNS suppression. Side effects, euphoria with high doses. Nursing considerations. Large doses of DM can be abused for CNS effects. Expectorants. Expectorants promote the removal of respiratory tract secretions. Guaifenesin, Mucinex, is a commonly used expectorant. Guaifenesin, common form, oral preparations. Uses, indication. Upper respiratory infections, URIs, and lower respiratory infections, LRIs. Mode of action, promotes the removal of respiratory tract secretions. Side effects, few reported side effects. Nursing considerations, administer orally. Antivirals. Antivirals are medications used to inhibit viral replication. We will discuss oseltamivir, Tamiflu, zanamivir, Relenza, and peramivir, Rabivab. Oseltamivir, zanamivir, and peramivir, common form, oral, inhalation, or intravenous, IV, preparations. Uses, indication. Influenza. Mode of action, inhibits neuraminidase, an enzyme required for viral replication. Side effects, throat irritation with inhalation. Possible systemic effects with high doses of oseltamivir, especially in children, leading to adrenal suppression. Nursing considerations. Administer orally, via inhalation, or IV. Initiate treatment within 24 hours of symptoms to shorten the duration of illness. Trivalent inactivated influenza vaccine, TIIV, and live attenuated influenza vaccine, LAIV3, LAIV4. Vaccines are preventive measures taken to reduce the risk of influenza infection. Influenza vaccines, common form, IM injection, flu shot, or nasal spray. Uses, indication. Annual vaccination to prevent influenza. Side effects. Soreness at the injection site, headache, sore throat, cough, runny nose, nasal spray. Nursing considerations. Administer IM to individuals aged 6 months or older. Nasal spray is suitable for healthy non-pregnant individuals aged to 49 years, but caution is advised for those with a history of Guillain-Barré syndrome, GBS, or sensitivity to chicken eggs. Defer vaccination in cases of acute afebrile illness. Anti-tubercular medications. They are crucial in the treatment of tuberculosis, TB, and leprosy. Let's delve into the details of the commonly used anti-tubercular drugs. Isoniazid, INH, rifampin, pyrazinamide, PZA, and ethambutol. Isoniazid, INH, common form, oral preparation, nidrazid. Targets, Mycobacterium tuberculosis, M. tuberculosis. Mechanism of action. While the exact mechanism is unknown, INH is believed to suppress mycolic acid synthesis in the cell wall of the bacteria. Side effects, hepatotoxicity, peripheral neuropathy, paresthesias of the hands and feet, rash, and fever. Nursing considerations. INH should be taken by everyone with TB infection. To prevent neuropathy, daily pyridoxine, vitamin B6 supplementation is recommended. Alcohol ingestion should be avoided. Drug-drug interactions with phenytoin should be considered. Administer before meals. Rifampin, common form, oral preparation, Rifidin. Targets, M. tuberculosis, and also used in the treatment of leprosy. Mechanism of action. Rifampin suppresses RNA synthesis, thus inhibiting protein synthesis. Side effects, hepatotoxicity and fever. Nursing considerations. Take rifampin on an empty stomach. It may cause orange discoloration of body fluids, including tears, sweat, and urine. Be cautious of drug-drug interactions with oral contraceptives, warfarin, and some protease inhibitors. Pyrazinamide, PZA, common form, oral preparation. Targets: M. tuberculosis. Mechanism of action: the exact mechanism of action is unknown. Side effects: hepatotoxicity and non-gouty polyarthralgia, joint pain. Nursing considerations: PZA is typically used in combination with other anti-tubercular drugs. Regular liver function tests should be conducted during treatment. Ethambutol, common form, oral preparation, myambutol. Targets: M. tuberculosis. Mechanism of action: ethambutol is bacteriostatic, meaning it inhibits bacterial wall growth. Side effects: visual disturbances such as optic neuritis, blurred vision, lack of color discrimination, dermatitis, pruritus, itching, and confusion. Nursing considerations: ethambutol is usually used when resistance to INH and/or rifampin is present. It is often used after other drugs have been tried. Caution should be exercised when using ethambutol in patients with renal disease.